Hello, everyone, and welcome to our introduction video for CCC Smiles. My name is Dr. Vandana Katyal, and I'm the specialist orthodontist as well as the founder for the clinical practice. And today, I'd love to introduce to you all about us. So the purpose of this video is to orient you about us, about why we do what we do, and how we can help you achieve that desired smile that you've been wanting as fast as possible and as comfortably as possible. So I'd love to take the next 15-20 minutes to introduce some concepts to you to help you understand what things have changed in the world of orthodontics. And this is a great video to actually know even before you come to your very first visit with us. So thank you for choosing us. The reason you're watching this video, you may have contacted us recently and booked a new patient initial consultation. And in that case, I really look forward to seeing you very soon. Or you might have found us online and booked a virtual consultation and uploaded your photographs for us. Either way, this is a video that really helps you understand what we're all about and what can be achieved for you. So let me just share my screen to get started. And thank you for your patience. So our practice is very driven by the philosophy that we like to get results fast, comfortably, and as beautifully, as excellently as possible. And there's a variety of ways to treat orthodontic patients. There's braces, there's clear aligners, and there's other ways. But we choose to do a lot of clear aligners, and I'll try to explain to you why. So I'm a specialist orthodontist. I've been in the dental industry since 2001 when I graduated as a dentist. Subsequently, I did a doctorate degree in Adelaide for orthodontics. And subsequently, I've also done degrees in business administration, design thinking, innovation courses. And I also operate a couple of other practices as well as businesses where I teach and lecture for dentists and orthodontists around the world about clear aligners. I'm very driven with clear aligner and technologies, and I probably consider myself as a pioneer in some of those areas. So I'm an Invisalign diamond provider, and this has been ongoing for several years now. What does that mean? It means that I do a very, very large number of clear aligner treatments, more than the ordinary dental practitioner or an orthodontic practitioner, and I focus my practice mostly on that. And I'll try to make you understand why. But before we go into the why, this is a short video that talks about what's important to us and how that translates to you in your treatment. So let's watch on.
All right, so orthodontist, scene 3, take 1.
Hi, I'm Vandana. I'm the orthodontist you see at CCC Smiles, and I'd like to tell you a little bit about what we do. At CCC Smiles, we believe in getting you the smile that you've always desired, as comfortably as possible, as easily as possible, and as suited for your lifestyle as possible. The North Shore vibe is all about fitting in with your active lifestyle. The North Shore people, what do they love doing? They love surfing, they love the beaches, they love eating out. The beauty of straightening your teeth and getting that smile in present times is that you can still do all those things without any discomfort. Invisible braces are the new irresistible. They're not just for adults, as you may think, but they're also now suited for kids and teens of any ages. We don't have to put braces on to straighten teeth nowadays. They can be done comfortably with Invisalign or clear aligners. The technology has come so far that we get precise results faster, better, and with way more comfort to suit your lifestyle. The beauty of straightening teeth nowadays is also that you can eat, drink, do whatever you want, live your life. I love Mosman, and I love having CCC Smiles in Mosman. One of the reasons I created this practice was to make you feel homely and welcome. From the time you walk in, this place is a home. It's not a dental surgery, and that's the feeling I want to give all my patients. To create that winning smile, see your orthodontist at CCC Smiles today.
Thank you for watching this video. I hope this was informative. Since our practice in Mosman, our flagship, very first practice that we opened, we also have Sydney CBD location that is available near Town Hall Station. So we suit many people who are near CBD as well, or can get to CBD. So let's talk about Invisalign. Invisalign is different to braces in many ways. It is custom created clear trays that help move your teeth sequentially. So you're given a lot of trays at once that you wear sequentially, and they're gently and slowly moving your teeth. But why do we use Invisalign so much and recommend it? Well, there's a lot of comparisons here, and some of this comparison now has good research behind this. So I've created this chart to help you understand why Invisalign or another brand, any brand of clear aligner, is possibly superior to braces in many ways. So number one, they're equally effective in straightening teeth in many cases. Then what I love about clear aligners, they're invisible. So we are much more conscious in today's times, including teens and adults, about how we appear. It is a different age we live in. We live in the age of millennials and I generation that are constantly on social media, and appearances do matter now. So I think that invisible thing is great, but also the fact that it's removable. So it's hygienic. You can brush and floss your teeth like normal. What's good about this is, especially with people with already some bone loss and gum disease, it really allows you to maintain an excellent level of oral hygiene, and your gum specialist to continue working and treating your gums while you're in treatment. So I really recommend this for anyone with gum disease or bone loss as well, over braces. What's also good is pain levels. Many studies now show, there's not one study, there's actually several that show clear aligners have much more comfort levels than any type of braces. In fact, the discomfort is only 1 to 2 days as compared to almost 14 days with many types of braces. And also the type of discomfort can be categorized as quite severe pain in some cases, whereas with clear aligners, it's almost negligible. So a lot more comfortable for you. You can eat whatever you want. There's no restrictions to your diet as compared to braces. And because there's not a lot of breakages that happen, you tend to have less emergency appointments, which is great for our busy lifestyles, okay? In our particular practice, the cost does not change. And in fact, it's pretty rare that we would recommend braces over aligners for certain cases. Your orthodontic visits, when it comes to clear aligners, because of the level of hygiene you can maintain, it is actually okay to not see an orthodontist for almost 3 to 4 months during treatment, as long as you're being virtually monitored. And we'll talk more about that in the coming few minutes. This is where we're very different. We don't just give you aligners, we give you virtual tracking technology so that we're behind you every step of the way. So when we're monitoring you this closely, you need fewer unnecessary visits, and we pick up any problems really fast. Because of that, total treatment times, now some research is also showing in simple to moderate type of cases, can actually be shorter with aligners when it compares to braces. So a win-win. And in fact, in my clinical experience, in my opinion, with all the cases that I have done, I always finish faster with clear aligners than I finish with braces. So in our practice, it's a no-brainer that that is what I would be recommending to you if fast is important to you, and also predictability is important to you. So treatment length can vary. You know, we have cases that are very mild where the tooth is slightly displaced, you know, within 1 or 2 millimeters. Something like that should be done in 3 to 6 months. When teeth are quite rotated, quite displaced, and often you have to change the bite a little bit, you could look into about 12 to 18 months. And often in more advanced cases where we have to remove teeth, or looking at surgery, or really changing bites significantly, like in a very different way in adults, treatment could go up to nearly 2 to 3 years, okay? So it really depends on your case, and it's hard to tell that over this video till I see you or have a little bit more understanding of your condition. But generally, these clear aligners are worn most of the day, 20 to 22 hours. They're only removed for eating and brushing, and they do become part of your life. It just becomes easy to do after a few weeks. What's involved is most of the clear aligner patients will need attachments. So what you see here are little white resin blobs on the sides of the teeth. They're just bumping out. And these little white blobs are temporarily bonded on your teeth to allow the plastic to grip these teeth better and move them. Now, in this case, you also see metal buttons on the down the bottom. These can be replaced with clear buttons. They're often used to put rubber bands if needed. Often we will do something called polishing or interproximal reduction. It's very gentle. Interproximal reduction has got a lot of data now to show that it's quite safe, especially the technique that we use. We do it gradually, slowly, and as needed with a hand strip like that. And it tends to be very, very safe the way we do it. So it's not even painful. It just takes a few seconds gradually every time you come. Technically, we remove a tiny bit of enamel. However, it is within very safe limits. So something that I wouldn't want you to worry too much about unless it was more advanced for your case, and then we can discuss that further. Elastics are also sometimes required, especially if we're bringing teeth down large distances. So these are rubber bands. They come in clear or colors. And these rubber bands help to pull teeth, okay? So, or change bites. So often used more in teenagers and sometimes in adults. But let me just show you a video of how easy putting rubber bands are. And you may need this type of treatment with clear aligners and rubber bands depending on your condition. So this is lovely Josh, and he's going to show you how easy it is to put the aligners on and wear rubber bands.
Hi Josh.
Hey.
Josh, how are you?
I'm pretty good.
So Josh is wearing his Invisalign teen aligners. He's on number
14.
14, and he's going to demonstrate how easy it is to put them on, take them off, and wear rubber bands.
Okay, so you get your bottom aligner or top. You want to put it on the bottom with the bottom.
Sorry, we're going to zoom in a bit here just to have a look.
And all you need to do, and just stick it in like that. Get the other one. You just put a little pressure on it and it's all good. It's
And
all
can
right.
you demonstrate your rubber band wearing skills today?
Yeah,
So Josh is supposed to be wearing rubber bands all the time.
you get 2 rubber bands. They're very small, as you can see. And you just get it on top of your hook that's on your Invisalign. Get it around it. You pull it down onto the attachment.
That was quick.
Yeah, it's really easy. There you go.
And
So it's a very easy process, as you can see. It took him seconds to put that on. What also is very unique about clear aligners, you often get a video of your treatment. When you start treatment with us, you will be emailed this video. And this video is for your reference to show you how the teeth are moving, at what stage, and by what time, and how many weeks the teeth should be relatively looking like that. So it's a great reference point. Of course, not everything happens as perfectly as planned, but majority of the movements programmed here by me will happen if you wear the aligners. What we also use and combine with aligners. So in my experience, if we just give you Invisalign, we often find treatments go quite long, and we find that people burn out, don't wear them. But when we combine this with this amazing app-based artificial intelligence technology called dental monitoring, we have just got our first clinical study accepted in our top orthodontic journal that showed that we reduced unnecessary appointments by 40% using this technology with aligners, and had movements that were more predictable. So it is a no-brainer that we use this for all our clients. We have put over hundreds of clients on this technology. The feedback has been great. So as you can see, we can even teach you how to do this virtually. You have these little blue cheeky retractors, and you're going to take a video of your teeth for us like this. This is a lady taking videos of her teeth with her Invisalign on, and you're going to submit these videos via your app every week to us. And based on these videos, we analyze how the teeth are moving. And week by week, we tell you whether you're ready to change your Invisalign to the next one or not. Okay, so if things aren't going well, we will slow you down. If things are going great, we often go faster. Or if we really think that something is not fitting well, we will call you earlier rather than wait later. So hence we improve predictability. And what's the coolest thing about this app, and a matter of a second clinical study that we're doing, is to have a look at the impact psychologically when you see this video, time-lapse video of your own teeth changing like this within the app. What I have found that a lot of our patients will come in raving about it and saying, oh, look at the changes in my teeth. I can see it in my phone, without even coming to see us for photographs. So let's show what can be achieved with Invisalign with some of our cases. So this is a relatively simple case where the lady just felt her smile was a bit narrow and her teeth were just a little bit forward. And she just wanted just an evening of the smile, more symmetrical smile. So what we've done here, as you see, dental expansion, we've increased the width of her smile, and it actually becomes much more proportionate now to her face and to the curvatures of her lip. This is another lady who actually felt her smile was a bit narrow. And again, with just simple aligner treatment, in about 12 months, we were able to achieve quite a symmetrical smile with even heights of the teeth. Another one like this, where we're talking about narrowness of the smile. So if you have a narrow smile and you're looking to some kind of expansion, 6 to 9 months is usually enough to change the smile width. Now, if you have things like what we call bite issues or crowding, then often it can take a little bit longer like that. So this is a case where they needed not only expansion, but also the midlines were a little bit off, trying to meet them, resolve the crowding. So something like this would take about 15 to 18 months. This is a case where we have something called a collapse bite at the front, called a deep bite. The lower incisors are not being seen very well here, and they're being overlapped by the upper front teeth. So by opening up the bite, we give them a much better chance of healthier gums, teeth, and function of the jaw. This is another adult case with something called deep bite, where you don't even see the lower front teeth. They're quite deep. Some of the risks of leaving a deep bite untreated can be subsequent damage to the upper front teeth, but it's not always in every case. And sometimes the damage is minor, but sometimes it's more than minor. So often we like to improve the deep bite or change it to ideal if we can. So this is a reverse case where now there's no overlap between the top and bottom teeth, called open bite. Now you may have open bite, and open bites are treated very well with Invisalign actually. In fact, for open bite cases, I will never use braces. This is a lady who actually had a lot of protrusion and crowding of her teeth. So she felt her smile was really full and a lot of teeth there, and we were able to, without extractions, is tuck them back by using a combination of polishing and expansion and resolve her crowding. So what you see here is a beautiful result in her smile without having to remove any teeth. Now we also treat teens. Teens have been in treatment in our practice for several years now, and we get great success. They wear their aligners very well, and they treat very fast compared to adults. So this is a 12-year-old boy who had a lot of bite issues, a lot of crooked teeth, a collapsed arch, and within 16 months, his treatment was finished. So it's a very fast treatment, very comfortable, very effective. This is another teen where one of the top canine was not erupting, and we were able to, without braces, with just Invisalign, help that tooth come down gradually and slowly into the best bite and symmetry that we could. This is another little kid who doesn't even have all the new teeth that have come through. He's only about 8 years old, and he had a bite issue that needed to be treated quickly. And just in 3 months, we were able to correct the bite and guide the new teeth into eruption. So aligners are very comfortable for kids. And lastly, this is a really young child who had a big gap between her top and bottom teeth. So she was getting her lip trapped. She was more prone to trauma of her upper front teeth because they were sticking out so far. However, with just Invisalign, clear aligners, and some rubber bands and 12 months of treatment, we were able to correct it as well as any other device on the market that can treat this condition. So finally, I'd like to bring up a video of the Invisalign experience of a couple of our patients who are adults and who started their journey together to give you an idea of what's involved in the first few weeks of your treatment, if you're going to now start with us.
This is Jackie and Justin. They've both started their Invisalign together and they're going to talk to you about their initial experience. So who's going to go first?
I'll go. So we're a month in, so we're just about to change from aligner 2 to aligner 3. It's great. We're really enjoying it so far. The first 2 days are a little bit sensitive, just while you're learning how to take them out and put them back in. Just getting used to that feeling. A little bit sensitive, but once you pass those 2 days, it's great. You really notice that they're on. We've both found that it's better having them in than having them out.
Absolutely. Yeah, it's definitely the attachments that I felt was the hardest bit, was the first couple of days, because they're a bit rough on the gums, which is why it's more comfortable to have the liners in. So keep them in.
Doing it together, we've got that constant reminder to each other to always stick them in.
Basically, for me in particular, hanging around with a bunch of blokes, I was quite nervous about getting Invisaligns because I didn't want to feel like I was wearing football mouth guards and was sounding funny to talk. But to be honest, nobody even realised that I was wearing any. I had to tell people that I actually got Invisaligns in order for them to know what I was going through. So you don't notice, you really don't notice that you've got them in. I don't know about you, if anyone knows.
I found the only people that have noticed are people who have actually done the Invisalign journey themselves, and they make a point of saying something to me because they're so excited that I'm on the journey and that they're so happy with their results. So those are the only people who really notice, because I think they're looking out for it, because after their journey they're so happy they look out at people's teeth. So yeah, it's been great. No one's really said anything. I found it hasn't been a hindrance in day-to-day sort of life. You get used to having your Invisalign container with you, and just part of taking them out, rinsing them out, rinsing your mouth out after you eat, putting them back in. It just becomes part of you every day.
It's routine.
So it's easy. Yeah, it's going to be totally worth it. Do it, guys, if you're thinking about.
So that's a great video, and I love showing that because it shares the experience of a couple together. We have siblings that start treatment together, parents and siblings, and I think it's always more motivational when you do it together. So at the end of your treatment, you have to retain. Otherwise, teeth will always move back. Retainers, as we know from all our research, is meant to be lifetime. So as part of your treatment, we will give you wires. Now, we try to put wires if it's possible. There's certain clinical conditions we can't put wires, but wires only hold the front teeth, you know. So you have to still have a clear tray at night to wear over the wires. For how long? At least for the first 5 years, quite a few nights a week. But after 5 years, maybe 1 night a week, and for as long as you can wear it. If you're 16 years and over and you're not breastfeeding and you have all the right clinical conditions, we could also do some whitening for you during your Invisalign treatment. So as the teeth are getting straighter, they're also getting brighter. You get the 3D movie of your treatments at all stages. You know what's happening and the final result, and a goodie bag with all the stuff that you need for your clear aligners to keep them clean and produce the movements that we need you to produce. Pricing is really variable in our practice, but also very affordable. It'll vary anywhere from a really simple case to a more complex case, and it could sometimes be even more than the 9,500 mark. However, individual pricing can only be determined when we take the right records for you, or you've submitted them via virtual consultation. So as always, if you were going to go ahead with your treatment and you decided, always, if you were to pay up front, it would be a little bit less for you. But we also have flexible pay plans via our third-party provider, Denticare. That is an excellent company that can also help you with pay plans. So thank you very much for listening to me. I hope this was informative. Now, I look forward to seeing you in our office one day and getting started and discussing this further and tailoring it to your particular needs. But I hope that this has given you a sense of what we do, why we do what we do, and how we can help you. I really appreciate your time, and I look forward to seeing you at CCC Smiles, Mosman, or CBD. Bye, guys. Thank you.